Welcome back to Esthetics Magazine. Discover more skincare resources at aestheticsmagazine.com. In this episode, we are going to offer a crash course in microdermabrasion. Microdermabrasion treatments are provided in medical settings and med spas as non-surgical cosmetic procedures and also as part of facial services in the aesthetics industry. There are two main techniques of microdermabrasion. The first one is crystal microdermabrasion. During this procedure, a device emitting pressurized flow of aluminum oxide crystals or other inert crystals like sodium chloride or sodium bicarbonate abrades the stratum corneum, and the ablated tissue and used crystals are vacuumed through the same handpiece nozzle. The depth of abrasion may be affected by the pressure of crystal flow, the number of passes, as well as the duration of passes on the treated skin. The second technique is diamond tip microdermabrasion. In this procedure, the technician uses a handheld device with a diamond-studded abrading head, instead of using crystals and creating no airborne particles. The various skin issues that can be addressed by microdermabrasion treatments include fine lines, wrinkles, mild acne, acne discoloration, and sun damage. After each treatment, the client may notice a significant improvement in skin texture and appearance. Lines and wrinkles will be less noticeable, and the reduction of acne is common. Additionally, the skin will display a pink or red glow, which gradually fades after a few hours post-treatment, leading to an increase in patients' self-confidence and satisfaction. While proper and adequate skin rejuvenation after new skin ablation is very important, patients should be cognizant of any progressive delay in the improvement or any possibility of side effects such as rash, increased redness post-treatment, etc., and seek advice from physicians. Lastly, the skin after microdermabrasion may be photosensitive. Patients should be advised to apply sunscreen with SPF 30 or higher and avoid direct sun exposure for at least 7 days. Also, it is important to avoid waxing and tanning for about 7 days and apply very mild products to minimize skin exfoliation and irritation for about 1 to 2 days post-treatment. In crystal microdermabrasion, a handheld device is used to create a gentle, yet aggressive exfoliation that removes the upper layer of skin. The device projects medical-grade crystals onto the skin surface. At the same time, it also vacuums the dead skin cells away in a sterile and controlled manner. The vacuum pressure and the level of abrasion are adjusted depending on the sensitivity and tolerance of the skin. In contrast, with diamond tip microdermabrasion, a variety of abrasive diamond tips are used to exfoliate the skin. The skin debris is also vacuumed away during the treatment process. The difference with crystal microdermabrasion is that no particles are being propelled onto the skin surface. Diamond tip microdermabrasion may be preferred in case it is necessary to exfoliate smaller or deeper areas, such as skin around the eyes or mouth. In addition, there is no residue from the particles since the tips are disposable and are to be changed for each client. Stainless steel and surgical grade wands are used in this process, which are particularly effective for acne and enlarged pores. Diamond tip microdermabrasion has the added advantage of being able to also stimulate collagen production, meaning that the effects are often longer lasting as well. On the other hand, crystal microdermabrasion has the high risk of leaving small particles in sensitive areas or around the eyes. Furthermore, long-term exposure to aluminum crystals can cause lung damage. Therefore, the client must be advised to close their eyes during the treatment, and it is even better to use protective eye pads. The treatment may be less comfortable for those with sensitive skin due to the abrasive nature of the crystal. Also, the treatment process may require more time compared with diamond tip microdermabrasion due to the sterilization process of the crystal projecting device. However, crystal microdermabrasion could be seen as a much simpler and more basic technology nowadays. Microdermabrasion treatment does offer benefits when it comes to exfoliating the skin and providing a much younger look. By removing the top layer of the skin, microdermabrasion can make the skin look smoother and more supple. This is certainly a benefit for those who have skin conditions such as fine lines and wrinkles, age spots, sun damage, uneven texture, and so on. It should be, however, noted that microdermabrasion cannot change the skin structure and it's not effective for all skin problems. It is not recommended for people with some skin conditions such as rosacea, eczema, dermatitis, active sunburn, herpes, lupus, or open sores. Someone who has taken isotretinoin, a medication to treat acne, within the past 6 months is also not suitable for microdermabrasion treatment. A person who has had a recent chemical peel, collagen or botulinum injections or has used Retin-A for more than a year is also not suitable for the treatment. Limitations also include the inability of the treatment to get rid of tattoos, pigmented areas on the skin, and the difficulties in treating around the borders of the tattoos. In addition, the eyes and mouth areas are usually avoided due to the fact that the skin is thinner around those positions and it's harder to create an even abrasion on the skin. Like any other types of treatment, there can be some side effects supposed to occur right after the treatment. The common side effects include slight skin tightness, redness, bruising, excessive skin peeling, mild irritation, and minimal risk of infection. Microdermabrasion treatments can be coupled with other facial treatments such as certain chemical peels. It is important to do the microdermabrasion first as it will remove a significant portion of the epidermal layer, allowing the chemical peel solution to be more effective. Also, products can penetrate more effectively after the use of microdermabrasion, so many other facial treatments are often performed immediately after this. For example, applying antioxidant products will be more beneficial after a microdermabrasion treatment since the deeper penetration of these products is achievable. Other facial treatments, including but not limited to hydrating masks and collagen creams, may be performed following microdermabrasion. However, experts advise that in general, it's best to avoid topical products containing retinoids immediately after microdermabrasion treatments. Topical products containing retinoids are often used after exfoliation procedures because they aid in preventing acne and keeping the skin's surface clear. But for a few days after microdermabrasion and while the skin is flaking, harsh products that may further irritate the skin should be avoided. Wearing a broad-spectrum sunscreen with SPF 30 or higher is always advised after any type of facial exfoliation procedure. This is especially true when combining microdermabrasion with other types of exfoliation because the skin becomes even more susceptible to damage from the sun's UV rays. When considering combining microdermabrasion with other treatments, both the esthetician and the client need to take the time to carefully consider the goals of the treatments. While all of the methods discussed in this section have been proven highly successful in clinical experiments, each patient's unique skin type and condition may affect the choice for or against the combination of microdermabrasion with other treatments. For example, consider using microdermabrasion for dealing with superficial aging, fine lines, wrinkles, and superficial scars. If there is a need to gain more dramatic and longer-lasting results, a series of microdermabrasion treatments may be supplemented by more aggressive treatments such as laser skin resurfacing, mechanical dermabrasion, or chemical peels. On the other hand, in order to maximize the benefits of microdermabrasion by enhancing the effects of the solution, many individuals couple the microdermabrasion treatment with a patch skin treatment or vitamin-enhanced facial. The type of topical solution and the length of the treatment highly depend on the grade of the treatment, the individual's skin type, and also the brand of the products used. However, in general, most of these treatments involve the use of the microdermabrasion solution for better penetration of the solution. Discover the natural power of vitamins with this new book, Understanding Vitamins in Skincare by Greg Rishaw. Learn how vitamins can nourish, protect, and renew your skin, all while embracing a healthy, balanced approach. Get your copy today and uncover the secrets to natural ingredients. Understanding Vitamins in Skincare is available now on Amazon.com.